onslaught and what measures they have taken and what needs to be done to better prepare ourselves. So these questions and these concerns will be addressed here. Today's discussion is timely as the situation in South Asia is worrisome. Unfortunately, there has been no significant regional cooperation could take place on the aforementioned subject. Every country is relying on its own channels, seeking help from the extra-regional countries to bridge the gaps in medical supplies, such as oxygen, vaccines. However, the situation is evolving as virus variants are potentially threatening this so-called makeshift arrangement in Pakistan, India, Bangladesh, Sri Lanka, and Nepal. Moreover, India's battle against COVID-19 has turned deadly, which is potentially risking spillover effects. South Asian countries, with their limited resources, have to take extra measures, not only to keep the virus at bay, but also to cater the pandemic challenges to the economy, food security, and governance challenges, health governance challenges specifically. So, what are the prospects of the success of existing arrangements by the respective countries to deal with the developing situation? And what are the prospects of regional collaboration in this regard? So, we seek answer from the esteemed panelists today. We have Ambassador Nadeem Riyaz from Pakistan, Professor Swaran Singh from India, Asanga Abeyagoonasekera from Sri Lanka, and Dr. Prakash Bhattarai from Nepal. I welcome you once again, sir. So the format is very simple. Since it's an interactive discussion, I'll begin with a few questions to the panelists. However, panelists can start with their presentation if they have already prepared. So the overall discussion is supposed to be wind up within an hour. And then I'll welcome the audience to ask their question verbally, and they can also place their questions in the chat panel. So we will pass on to the esteemed speakers. So I begin with Ambassador Nadeem Riyaz, who is currently heading this institute. Previously, he was serving as Director General of Foreign Service Academy. During the course of his long career with the Foreign Office, he has held many key positions at the headquarters, including Director Europe, Director Administration, Director Foreign Service Academy, Director General China, and Additional Foreign Secretary Europe. His posting abroad include Second Secretary High Commission of Pakistan, Pretoria, South Africa, and Deputy Head of Mission Embassy of Pakistan, Paris, in France. He served as ambassador to Sweden, Finland, Estonia, and Latvia from 2019 to 2013. He was Pakistan's ambassador to Italy from October 2015 to February 2020, and was concurrently accredited to Slovenia, Albania, and San Marino. Well, with this introduction, Ambassador Riyaz, sir, would you please briefly apprise us how did Pakistan manage the first wave of COVID-19? What measures the government took to flatten the curve? So over to you, sir.
Thank you very much, Imran. Thank you for a very kind introduction. COVID is something which is of immense importance to everybody around the world. It has really changed the way we think, the way we live, the way we interact. Like webinars, meetings, physical meetings are now. It's something which is not normally done because people are pretty uncomfortable about it. But once before I get into really talking about how Pakistan handled the first wave, just let me give you some of the figures which we are facing in Pakistan today. We are a country where we have people who are affected by COVID today, around about 900,000 people. The fatalities are around about 20,000. About 818,000 people have fully recovered, while there are about 4,000 people which are critically ill. Pakistan comprises provinces, and if we go to a province-wise breakdown, Punjab has the largest number of cases at 334,000. Sindh has about 308,000 people suffering from COVID. The KPK has 129,000. The federal capital has about 80,000. Balochistan has about 24,000. AJK has 18,900, and Gilgit-Baltistan has 5,500 people who are suffering from this deadly pandemic. Now, the thing is that right from the beginning of last year, we're talking about February or so, we were in the spotlight as we are sandwiched between the two epicenters of coronavirus. One was China and the other was Iran. In the month of February last year, we had the first two reported cases of COVID. And after that, the government started thinking about it. There was seriousness. We had the National Command Authority, which was looking after and basically looking at this pandemic. And then by the Pakistan went up to about 7,000 people. All over the country, and fatalities. At that point of time, I think the country acted very prudently. It was able to seal the western border with Iran and Afghanistan, and the government started putting checks at the airport. When you came in, your temperature was checked. The quarantine thing started. The government then imposed a sort of a smart lockdown. Pakistan did not have the luxury because of the large number of population plus the economic situation in the country. And countries, that was not the case. So the government embarked upon a policy of a smart lockdown, meaning thereby that the areas where there were pockets of cases, they were closed, schools were closed, colleges, we closed the cinemas, the restaurants, and by doing that, the number of cases not only decreased, but like the further spread of this was of this deadly virus was arrested. Now, at that point in time, we didn't have that many of the testing facilities. The government started investing in developing those facilities. We started getting the PCR kits. Initially, they were expensive, but then, over the period of time, their price has gone down a bit. The government also embarked upon a policy of extensively using the social media, using the religious leaders also to actually telling the people that, this is something which is deadly, and you have to take care of that. Pakistan was, I think, a bit lucky in the respect that it was by and large in the first wave of phenomena which really tackled which really was the cities, and obviously Pakistan as a developing country is one where rapid urbanization. The checks and balances which were put in were in the cities. The lockdown strategies was targeted in the cities, and then I think the government put restrictions on weddings. People were allowed to do outdoor events, but because of the various inter-provincial travel restriction on unnecessary travel, the use of masks, reducing the strength of people working in the government offices selectively. So, those were the strategies, I think, which Pakistan was able to utilize. And we saw that COVID was within control. But like, I mean, we are people who are basically people friendly. We love mingling. We love getting together, getting together in the evening. It's part and parcel not only of Pakistan, but the entire region. We're a very, very warm population when it comes to the entire region of South Asia. But the basic thing is that also creates problems. So people had to change their way of life, and their way of life actually changed. Interaction became reduced, and that helped arrest the spread of the virus. So, Imran, if you allow me, can I take it through to where we are today, so that we can see that how the country dealt with the first wave, the second wave, and now is dealing with the third wave. And then I can take about 5. Give
yes, please.
Brief perspective of how it is going.
Yes, you're
So,
briefly. So,
okay. So, Pakistan was able to tackle the first wave relatively successfully. We the way the situation was handled was also low, but we worked very closely with the WHO and with some of our partner countries like China. So there was a lot of help and assistance. But obviously, as the situation started improving, the lockdown and all started moving away, life became normal again, somewhat normal, but maintaining all that. And then we got stuck by the second wave. Well, some people said it was the policies of the government, the smart lockdown, the government giving subsidies to people, giving, under various schemes, really maintain their households, the limitations on travel and all. But along with that, a number of people feel that, it was heat because, the heat and the climate, and then as the people of the country are much more resilient to the various, those strains which you get, because cleanliness is not to that extent as in Europe. We don't use the central air conditioning in most places. So open spaces. So what you must keep in mind is the way the population in Pakistan has grown. We have over 64% of the people who are less than 30 years of age. So that also, I think, was a factor. Well, then came the second wave. The second wave hit us. We still adopted the same measures, able to again, come out of it. From the start of the present year, when this third wave struck, it was in which at its peak, and now we have actually crossed the peak. We were getting anything between 3,500 to 4,000 people cases a day in the country. And yesterday, the health minister of Punjab said that the cases now have gone down to about 940. We had to take very, very severe measures. As you all are aware that, we had the month of fasting, and after the month of fasting, we have the month of Eid. during the last week, the government had to virtually close down shopping areas, the shopping malls. It very reduced hour for shops. We closed the restaurants, both for indoor and outdoor dining. Only takeaways were allowed. So interprovincial transport again came under a lot of checks, and there were restrictions. And at the same time, the government embarked upon a scheme. We got were from China. We started getting other vaccines also. So the government started with 70 plus category, then it came down to 60. And now, as we speak, we can get people inoculated from the age of 30. So this is where we are right now. And an interesting thing is that in some European countries, this option is not available. But now what government has done is you can virtually walk in and get your, if you are above 30 years of age. And in addition to that, private hospitals have also been allowed to get the vaccine. Obviously, like, you know, I direction, but like, you know, I think somewhere the figure is, or anything, it could be 15 to 20,000 Pak rupees, or probably even slightly less than that. So this is where we are. But despite of facilities in Pakistan from today, which is like, you know, outdoor dining is allowed, indoor dining is still banned. You can still do marriages, you can, but the number of people have to be reduced. Schools and colleges will open. They've kept a threshold of 5%. Obviously, will be allowed to open, but if it is less than 5%, you know, schools and colleges will open 50%. So this is how the country has tackled the spread of coronavirus. We have lost a lot of lives also. But if you compare that to what others have lost, it's much less. But it is one life, like, you know, it still is a life which is lost. Be complacent. I think we need to work much more. I think we need to work not only with World Health Organization, with countries like China, with other manufacturers of the vaccine, but I think we need to have some sort of a regional approach also, because, like, you know, it's something which not only affects Pakistan, India, Nepal, Bangladesh, it affects the entire region, and sadly, we lack a regional approach. So I would like to stop here. And I said I will not take more than 10 minutes. So I hope I've maintained the time. And I remain available to answer any questions. Thank you very much.
So briefly, you have still 2-3 minutes. As you have just mentioned, the WHO, the World Health Organization, which had been under the severe criticism, particularly from the United States in the beginning. So how Pakistan's experience with WHO? So would you please shed some light on it? How did Pakistan?
Look, you know, our experience with the WHO has been, I would say, relatively positive. You know, whenever, look, we are a developing country. When we approached them, we found them to be receptive. We found them to help us, to assist us, because they had initially they had the relevant knowledge and the database. We were developing it. And I think I forgot to mention it in my brief presentation, and that was due to the paucity of time. when we started dealing with the coronavirus, we didn't have a base. But now we have developed that. We increased our health facilities. We got more ventilators. We got more oxygen. So now in Pakistan, there is no shortage of either the hospital beds or the ventilators or the oxygen cylinders. Yes, there was a particular time when there were issues that they weren't free beds which were available, but we have moved beyond that now. And yes, the WHO has helped us now. Yes. So I don't think that there is any fine, whenever criticism at various international organizations also, but our experience with them has generally been
Fine. So, do you think we have gathered enough experience so we can easily handle the third wave or the future waves in Pakistan? So, does the Pakistan has the capacity to deal with the future waves of this pandemic challenges? So, what's your take on this?
Imran, my biggest fear is that coronavirus is a very interesting virus. It's a virus which just mutates. So, like you have the one coming in from Europe, then you have the one coming in from South Africa, then you have the one coming in from the UK. So all these strains are more deadlier than the first one. But I don't think that dealing with this type of a virus is easy. It's going to have challenges. It's going to be difficult. And I think we need to constantly work with international that we can tackle the threat relatively we can tackle the threat in a way leads to minimal loss of life. Because I'm not going to say that we have reached that stage where we are in a very comfortable zone. No, I don't think any country is, and I think there will be challenges which we have to see and then devise a strategy to overcome.
Sir, one last briefly comment. As you have mentioned that we should cooperate on the regional level. So, what are the prospects on the regional level? What are the prospects? Then I'll move to the next speaker. Ambassador Riyaz, would you please respond to that? Are you listening, me, sir? Your speaker is. Please unmute yourself. Unmute.
Yes, please go ahead.
So, one last question, sir. As you have mentioned that we should cooperate on the regional level. So, do you see any prospects of regional cooperation during these days with India cooperating with Nepal over the SARC? So, do you see any prospects of regional cooperation?
I would, very personally, I would love to see a regional approach to deal with the pandemic. The only problem which we have with India, doesn't deliver because it's some sort of a hostage.
I think there is an internet problem on President Ambassador Nadeem Riyaz side. So I just say thank you, Ambassador Riyaz, for addressing very important questions. I agree that the archaic health system is the biggest challenge that demands the aggressive measures. India. The country has reported more than, I think, 26 million cases so far. So how and why the India reached to that stage, and what measures the government is taking to flatten the curve, and is India going in the right direction, or what is India's take on the what is your take on the regional cooperation on pandemic? We seek the answer to our next panelist, Professor Dr. Swaran Singh from India. Before giving floor to Professor Dr. Swaran Singh, I would like to tell the audience that Professor Swaran Singh is a professor and chair, Center for International Politics, Organization and Disarmament, and at Jawaharlal Nehru University, New Delhi. He is also president of Association of Asia Scholars, General Secretary of Indian Association of Asian and Pacific Studies, visiting professor, China West Normal University, Research Institute of Indian Ocean Economies, Kunming, senior fellow of Charhar Institute of National Security, Sri Lanka, and Sichuan University at Jinjiang College. So he has published in Journal of International Affairs, in the Journal of Australian National University, Journal of Indian Ocean Region, African Security. So the list is long, and with this introduction, I request Professor Dr. Swaran Singh to please present the Indian situation in the light of the question just raised. Over to you, Professor Singh.
Thank you, Doctor. Thank you, Dr. Imran Sardar. Let me begin by complimenting Ambassador Riyaz, you and the rest of the team at Institute for Regional Studies in Islamabad. Long back, as you remember, you had hosted me there, and I'm delighted to reconnect with all the friends. I'm also indeed delighted to be with my co-panelists who are sharing the platform with me, Prakash and Asanga. I think question of India is up in the face for not just India, but possibly for the rest of the world. The biggest challenge that we face from the pandemic as a shared common enemy of the humanity is ignorance that we have in recognizing the challenge. So we are using statistics, and statistics are of all range and variety depending on how we calculate them. And then, of course, they are constantly changing. So right from the beginning last year, Tedros, the Director General, had also shared with the world the enemy that is also there along with COVID-19, and he called it infodemic. Pandemic of information, which is exploding minute-to-minute basis on social media, which itself not just creates a panic and knee-jerk reactions, but also sometimes leads to wrong assessments as to what is the real enemy, what is the real challenge. So I think understanding the challenge is the first most important thing I used to argue. Second, if you look at the only lesson that history provides us, is to go back and look at the Spanish flu. What happened? We've already surpassed the number of infections that are estimated to be there in case of the Spanish flu, but number of deaths are far smaller as of now. Every person's life is extremely significant. So each death must be stopped from occurring. But that means that the Spanish flu also again has only limited lessons to give to us. We are talking today of Spanish flu second wave, having inflicted about 40% of infections and deaths in a broad brush manner, which means the second wave was perhaps the most challenging as far as Spanish flu is concerned. So I wish to underline, let us be cautious when we say, oh, now in COVID also, since we are crossing the second wave, it is now on the way to exit. Now that may not happen. We do not know as of now. So ignorance is something that continuously has to be dealt with. And there are enormous differences among great experts around the world who we depend on. Now, for example, different countries have had different assessments of what is that they are facing. We now are facing different mutants. They're very, very varying virulence, their transmission speed, their infliction potency. Likewise, also a whole range of antidote medicines for treatment and vaccines. So even among great experts, there are variations in assessment. For example, at the same time, different countries are talking about what should be the ideal gap between the first jab and the second jab. In India, we were talking about 6 weeks to 8 weeks initially. Now we are talking of 12 to 16 weeks. UK was talking the same much earlier than India, said similar things. So ignorance, I think, is the most significant challenge that we face. Therefore, knowing your enemy, as the great Chinese scholar Sun Tzu says, is half the victory itself. So once we understand what is our challenge, that would itself help us overcome and address or redress the challenge that we face. So India, for example, in January was feeling, very comfortable. In fact, the whole world was beginning to talk about Indian exceptionalism. So, for instance, whereas United States, the most developed, most powerful country, had sort of experienced about 1,120 deaths per million. India's death rate at that time was about 110 per million. So India was being projected as a country that has unusually successfully controlled the pandemic, and Indian exceptionalism. In fact, Pakistan likewise, 5th largest country in the world, but I think 26th or 29th in case of infections and death toll. So very different picture was appearing until we moved into what we are now called the second wave, in which we have had enormous infections. Indeed, if you remember, during January, India had opened up its exports of medicines and vaccines to the whole world. So in that sense, one has to constantly update understanding and knowledge and constantly update the policy responses. So enormous flexibility on the part of decision makers, which in democratic countries is not very easy, because democratic power elites have to be very careful in calibrating their policies, because the whole entire mass of their constituencies must understand those responses and must accept those responses as legitimate. So there is a time lag that happens in decision making sometimes, which is understandable. And as Mr. Niazi just mentioned, the human race is very gregarious. We love to constantly connect with each other. And whole human evolution has been part of that building mutual connect, making it more nuanced and enjoyable connect. And now we are facing an enemy which is undermining that basic premise on which human behavior is built, which is to connect with each other. It expects us to have physical distancing. I don't know why it is called social distancing. It expects people to have physical distancing, and by reflex, all of us very often fail to do that. And therefore, there are some things which are fundamentally instinctive to human behavior. And this challenge expects us to control our instinctive behavior. So if instinctive behavior of humans is very difficult to control, so is the instinctive behavior of nation states. In psychology, we say whenever human beings face very stressful situations, and they get locked into or they become prisoners to what psychologists call a Neanderthal stereotyping, which means we are guided much more by habit rather than cognitive responses. So you saw under enormous stress, states also behaved likewise. They sealed their borders. They immediately announced national lockdowns. That created its own new crisis of unemployment, of social dislocation, of people, trying to transit from one place to another. So knee-jerk reactions to finding solutions created much more new problems. And that's not just economic hit that most countries have had in South Asia as well, but also the stress it has caused in overwhelming our health sector. For example, most of South Asian nations are already sort of weak on health sector compared to developed nations. And we saw what happened in developed countries as well. So our health sector has got hit. I come from education. So education sector has also received enormous hit. There are a whole generation of younger people who will, have to work hard to get up to speed to, living a normal life once and when we are out of the pandemic. There's a recent UNICEF study, and India, of course, we pride ourselves to be called as the IT power in the world. But I saw that UNICEF report says that internet penetration in India is about 24% in urban areas and 4% in really remote areas. And if education has moved on to online teaching, you can understand that there's a whole population of India. And likewise, same is happening in other South Asian countries. So education and youth is being hit. And we always used to pride of India's and South Asia's democratic and demographic dividend. Both are under stress. So when we are dealing with an adversary which is spreading virulent multiple mutants of the virus, our systems, our instincts, our behaviors that are supposed to help us cope are also under stress and also incapacitating us in how do we deal. And now I want to underline the whole variance in our experience of pandemic and responses, which means South Asia also has not been able to develop for various reasons, some organic, some artificial, not develop a common understanding and a common response, simply because to begin with, South Asian countries began to get infected very differently. Nepal, for example, Prakash would vouch that was the first one to receive a visitor from Wuhan in early January. And that was the recorded case of infection, followed by other countries in India. Pakistan, incidentally, was last to get infected. So the variation of how each of these countries were getting infected was leading to responses. So in some cases, some countries pushed in for quarantines. Some South Asian countries, like say Maldives, which depends enormously on tourism, or Bhutan, or even Nepal, it depends on tourism, believed in quarantine to begin with. India chose to go for a national lockdown, and that created its own challenges. So knee-jerk responses from these countries happened at different times and of different intensity and of different channels and mechanisms. And therefore, we had a very different understanding and approach to how in South Asia we were dealing with it. And nevertheless, we all understand that the South Asian Association of Regional Cooperation decided to have a summit meeting on 15th of March. Among others, it was a good news because from 2015 onwards, the SAARC summits have not happened. So, if you allow me, there are also positive spin-offs of facing a shared crisis like this. So we had a SAARC summit meeting, a emergency fund was set up. All nations contributed to that fund, and that's interesting. And then, of course, soon after that, health professionals had their meetings. A whole portal was created. The Afghanistan president proposed that we should have a shared common platform for telemedicine, for example. So the spin-offs of some things that all South Asian nations were trying to expand connectivity, which is virtual connectivity, build digital economy, digital connect, received a certain boost here. But of course, it has not been able to still take care of all people in South Asian society. But those trends also got a positive boost in that sense of digital economy, digital connect, telemedicine becoming much more sort of important, and education online becoming much more important. So variations that continue to be in our understanding, in our receiving infections, in our responses to those, of course, also did two things. One, that it made us look at our problem differently, and therefore not really encourage a shared common understanding and a common response. And then, of course, we got into second wave, which was much more stronger, especially in case of India. And that has made us really much more focused inside, because we still live in nation states format, and governments have responsibility to provide security and healthcare to their own citizens first. So India, for example, which was so enthusiastically distributing medicines and vaccines to all the South Asian neighbors from January onwards, in March decided to put a certain halt on that. Partly because of the ban that the United States had put on raw materials that were supposed to come to the Serum Institute of India, which was the most important asset India had in producing the vaccine. So in that sense, several varying understandings and hits to each of these nations, and now the second wave created this situation where something that had begun to showcase a South Asian cohesive approach to dealing with the pandemic has received a certain, I think, neglect is an ideal word to perhaps use here. And therefore, I think everybody now back again is looking at their own domestic situation. But we also understand that once we are able to understand and stabilize our domestic situations, and Ambassador Riyaz just said that in Pakistan case, the sense of stability is beginning to come about. And likewise in India, we are talking of moving towards end of the second wave in the country, numbers which had gone up beyond 400,000 infections per day have now really come down. But we also understand in case of India, lockdowns have produced really good results. But lockdowns is not something that can be sustained. My own city, for example, has had about 4 weeks of lockdown. But that's not sustainable strategy to deal with this pandemic. So we will have to see that governments begin to open up again gradually. And this stability is a place when we again begin to look at how can we work together, complement each other, develop kind of complementarity in our relationship. And I wish to underline something before I close my initial remark. I think because we are today talking of moving towards relative stability in the rate of infections in entire South Asia today, some countries are better than others, for example, right now, but most of them are moving towards end of second wave. Some are even talking of the third wave. It's important time, and I want to compliment IRS to initiate that discussion today. As you know, from today itself, the World Health Assembly has come in session for a week-long discussion on how to address this pandemic. And incidentally, it is India which is the chair of the World Health Assembly. It was elected so last year in May again. And among other things, the World Health Assembly is going to consider an international treaty on fighting with pandemics. This is something that was recommended actually in World Health Organization's 2019 report, which had talked about 5 urgent actions need to be taken in global healthcare, and one of them was how to globally address healthcare emergencies. So in March, I think 21st to 22nd March, about 29 heads of government had sat together with the Secretary General of WHO, Dr. Tedros, and proposed that we should now begin to consider of creating a global treaty on fighting pandemics. And that global treaty for fighting pandemics is now under discussion as we speak, as the World Health Assembly opens its week-long session today. I think this is time to build that public opinion for our constituencies, for our leaders. And that's why I'm saying I really compliment IRS in the very first day of this week-long discussion, deciding to have this very significant discussion on responses that South Asia has had and how the cohesiveness of South Asia, which germinated after a long gap, actually after 5 years, SARC summit meeting happened, is now feeling little, not really the most top priority among nations. But with stability, maybe we go back to the talking table of SARC level responses. And this both discussion that IRS is initiating, the discussion that World Health Assembly is initiating, could perhaps give us an impetus to push forward that shared understanding at the regional level. Because even if the last man standing is infected anywhere on the planet, none of us can feel secure because the pandemic knows no borders, no national boundaries. And therefore, it's a collective challenge that all of us face when we are under enormous stress, as I said. We begin to be guided by Neanderthal stereotypy, which is habit-driven responses. But as we begin to stabilize the situation, as we are doing now, perhaps a cognitive response is expected from all of us at individual level and also at national level. So I'm assuming that we will hopefully see SARC level initiatives reviving and returning that cohesiveness and contributing to the larger debate as to how this pandemic has to be addressed, because it is not going away very quickly. And the very last point in 30 seconds I wish to underline and make is, if you look back last 20 years, because of enormous explosion of connectivity around the world, all diseases from SARS to Ebola to MERS to H1N1 to bird flu to now COVID-19, they have increasingly become transnational because of connectivities. So therefore, COVID-19 fight is immediate on our hand, but this healthcare challenge may not disappear in coming years. And we might see more of the similar challenges coming up. So therefore, I think developing long-term responses to healthcare crisis is something that we at our level as think tanks and academics should begin to focus on. And I think nations also should begin to think of how the focus of national security now has to go beyond protecting our boundaries and looking at military power of countries and how we can fight nuclear wars and others. National security now has healthcare as a very significant component, because if healthcare crises keep reoccurring, then none of us as nations are secure. And therefore, healthcare has become today an integral part of our national security strategy. And if you understand that national security looks at healthcare as an integral and component and critical part of national security, then our responses perhaps will be far more nuanced and far more focused. And let me stop here because teachers sometimes go on tangent and talk far too much. So let me immediately stop there. And I look forward to listening to two of my very dear colleagues, Prakash and Asanga, and we'll try to answer if you have any questions. Or if people who are participating, I see 22 people with us. If you have any comment or questions to me, I will be happy to respond to that. Thank you for making me part of today's discussion.
Thank you very much. Thank you, Professor Swaran Singh, for sharing the details. I agree the ignorance played a big role that led to they underestimate the threats of the COVID-19. As we are talking today, I was just reading an article that there is another disease, black fungus is also attacked. So we have to be very careful and extra vigilant, and we need, as you said, we really need regional cooperation, at least to deal with the health crisis in the region. So with this, we stand by with the people of India, as it is not a time for point scoring or a blame game. We have to learn from each other's experience to move forward for a greater cause. So now we move toward to have some situation, what's going on in Sri Lanka. So health experts from around the world have been using Sri Lanka's healthcare system as a case study since 1980s. So because of its efficient disease surveillance system for both communicable and non-communicable diseases. So how did Colombo dealt with the first wave of COVID, and how it is dealing now with the pandemic challenges, since there is again a sharp rise in the neighboring India. So what challenges the Colombo is facing? To discuss these concerns, we have Mr. Asanga Abeyagoonasekera from Sri Lanka. He's a well-known figure not only in Sri Lanka but also in Pakistan now. Mr. Asanga is an international security and geopolitics analyst and strategic advisor from Sri Lanka. He is a senior researcher for Social Impact USA. He serves as the senior advisor for security and geopolitics to leader of opposition in the Parliament of Sri Lanka. He has led 2 government think tanks, providing strategic advocacy on foreign policy and defense in Sri Lanka. He was the founding Director General of the National Security Think Tank under the Ministry of Defense, INSSSL, until January 2020. So before this, he has served as the executive director at the foreign policy think tank, the Cardigrammar Institute, LKIIRS. He was the advisor to Minister of External Affairs from 2011 to 2015. With this introduction, I request Mr. Asanga to please apprise us about the situation in Sri Lanka in the light of the question just raised. Over to you, Mr. Asanga. Please unmute.
Yes, let me thank IRS for the kind invitation, as well as it's always a pleasure to be with such a distinguished panel, Professor Swaran, Singh, and Ambassador. So, so thank you. Let me add the Sri Lankan perspective for this important discussion what you're having right now. Sri Lankan situation right now is not so good comparing to the first wave and the second wave, how we managed. We have 1,000% increase right now, and 3,000 cases every day, about 40 to 45 deaths, I mean, every day. So this situation for the last 30 days, which started from April to now, you see a significant spike of increase. So if this continues, I think it'll be, it's already difficult to manage. The health professionals have mentioned to the president as well as to the authorities, has clearly mentioned that the difficulty of managing the situation right now in Sri Lanka. So I think, let me sort of, I mean, I'll give you a few points that I sort of, jotted down. I would like to begin now with the initial point, referring to the work of Professor Ian Goldin, his new book, Terra Incognita. Let me quote Professor Goldin. He says that countries with functional democracies, such as New Zealand, did not bend the curve, they crushed it. Meanwhile, nations with populist leaders experience soaring rates of infections and deaths. I completely agree with Professor Goldin, and being a student of Professor Goldin 6 years ago, where he clearly mentioned in Oxford University, where he wrote a book called Butterfly Defect, which was published by Princeton University, highlighting that the next financial crisis will be from a pandemic. And where we actually questioned Professor Goldin, saying, look, aren't we are very tech savvy. I mean, we have the science of handling a pandemic. Why are you even speaking about a pandemic? This was the discussion in the class. But Professor Goldin kept on saying, look, it's going to be a pandemic. And one of the reasons the book was ignored by many academic circles, as well as many governments or many of the butterfly defect, I think I refer to what Professor Swaran Singh just mentioned. I mean, few of the points of the infodemics where he clearly mentioned some very important points is because of the lack of track two diplomacy. Now, I'm referring to the work of Joseph V. Montville, his 1981 paper, where he clearly says that, the track to diplomacy is so important, the unstructured, the diplomacy, the altruistic way of looking at the strategic options, not government, but non-government. Do we even have, in South Asia, how much of significant track to diplomacy is there in South Asia? I kind of bring that question. The psychological barriers to our problems, the national problems, ethnic issues, be it, why we can't have a security architecture is because we cannot have a proper track two diplomacy in place. Track one does not, has not solved many issues because the absence of the track two. Clear example is Jaishankar's visit in Colombo a few months ago, where he says that, okay, let's work on the devolution of power, which is so important. It is important for the country. Let's look at, securing Indian projects and all. But both the request was sort of turned down by Colombo government. Devolution was not spoken much. The Human Rights Council, you saw what really happened at the Human Rights Council. And then the Indian project of the East Container Terminal swapped to the West Container Terminal. So the track one, does it actually work? My first question is that, as it sort of, we signed a trilateral agreement with the three countries, India, Sri Lanka, and Maldives. But what have we sort of, it's an achievement on security. Those are security intelligence sharing. So what have we done? So you need the track two. That's my first point I want to sort of bring in. And again, referring to the work of Professor Gold in the systemic risks that are there, exposed our countries. What really happened was the systemic risks that are there in our countries, which was not much discussed. It exposed. What COVID did was it didn't break our systems. It just exposed us. It just exposed how weak we are. For example, the leaders on the first wave, on the second wave of Sri Lanka, there was clear hubris in the region, not only in Sri Lanka. They focused on religious festivals, on keeping elections. So the life was just going on back and forth. The messaging to the public was like, don't worry about COVID. No, COVID is not there. COVID is there. Sort of mixed messages was going to the public. So if you look at in Sri Lanka in April, everybody celebrated the New Year, then there was not much. Then all of a sudden, after the New Year celebrations, you have COVID. So I think the hubris part needs to be highlighted here, the overconfidence, where Sri Lanka even referred to a Lowy Institute report saying that we were one of the best to tackle, COVID and all that. No, it's not the case. We should have looked at our limitations in the health system during that time. We should have addressed some of the pressing issues that was highlighted by the medical authorities. So I think its leaders need to sort of move away from the hubris mentality and get into the what's going on. The realist perception is required. And South Asia, it has I agree with Professor Swaran Singh of the absence of a regional security architecture. And what really happens is that countries don't coordinate in the absence of the regional security, be it SAARC, be it BIMSTEC. This I have highlighted in my new book, The Conundrum of an Island, how SAARC actually contributed so much to the regional discourse. At least we had a discourse. But now there is absence of a complete discourse. You see also very unfortunate. You see extra regional powers coming in at a time like this, taking advantage of the situation. For example, if you look at the port city bill, which was passed during the time of the pandemic, as well as during the lockdown and the semi-lockdown time. Right now, if you look at it, there's not much of debate, only one day of discussion in the parliament. and this is the port city to China, an important bill that should have been discussed further. The bill's discussion, where extra jurisdictional rights was to be given to the Chinese, the project, did not discuss much on the strategic side, which and there was no time for it. So countries, I mean, you have leaders with ultra-nationalist majoritarian parliaments in place, taking advantage of the situation. That this shouldn't be the case, because you would face significant consequences of taking advantage at a time like this to pass bills. And one of the barriers that we have for regional cooperation is this the inward policies of nations. You have very mercantilist ideas coming out of the countries to cater to their own voter groups or the majoritarian voter groups. The ultra-nationalist position, as well as the semi-autocratic models, what you see in South Asia does not complement regionalism. It doesn't support regionalism. So it does not have a platform to talk about regionalism. So this is very unfortunate in South Asia. So what I think the nations require is also recalibration of like Sri Lanka of its foreign policy, which is now tilted more towards China. And in this recalibration, what I'm talking is about making a balance, because the moment we lose imbalance, there is significant instability which we invite, and we won't be able to tackle the issues such as pandemic or internal security issues. So this is a serious concern. Now you have vaccine diplomacy carried out by many countries. Russia has given us I mean, it's a great assistance given by Russia right now by giving us Sputnik. Then you have China, the Sinopharm, as well as they call it the Great Wall of vaccines will be built along the BRI, so a nation. So I think all these nations are assisting Sri Lanka right now, including India, but only 6% of the population is vaccinated in Sri Lanka. So it's not enough, and we should have thought about it earlier. But now that we are facing it, we need to get vaccinated, our people vaccinated somehow with all these donations and accepting all that. But here, China's case is quite different. It's because of the infrastructure diplomacy that they're carrying out in the island. The strong Chinese sphere of influence is there. So on top of that, another layer of vaccine diplomacy is been created. So which would add to the Sinosphere in Sri Lanka. And I think one of the most significant areas, I mean, is been sort of the absence of the regionalism is due to the lack of track 2 dialogue. And the host governments, basically, I think in Sri Lanka especially, there has been a suppression of basically think tank work, as well as if you look at being at the Institute of Kadirgama Institute of National Security, so there is on track 2 discussions. There should be more of it, rather than sort of looking at the most favorable think tank or to look at. You need to have more public discourse in this regard, and this is really important. There is multiple information that's out there creating xenophobia, creating, for example, the language, which with the Chinese language in one of our national plaques that was used was a serious issue. So that created an extra sort of xenophobic mentality. So these needs to be addressed at the track 2 level. So what I'm saying is that the absence of discussions, papers on the port city, or be it the pandemic on doctors, for example, the academic work that was highlighted on the 8th of April the Doctors Association as well as they came out and said that, look, the country needs to go on a serious footing, but it was ignored. So I see a pattern of ignoring going on from many years. I mean, be it in the global level, be it in the local level, and this needs to be addressed to sort of come out of this problem. So where regionalism can be built is on platforms that that we have, such as this, the think tank level or the policy level. So that the leaders need to invest in it. Seeing another option, and a diverse option, or an option that is not favorable to the leaders' discourse or the discourse of the government, you should see it as a positive way. Should see as a way to look at, okay, these are alternatives that has been discussed. So I think South Asia needs to have that maturity. It lacks that maturity. So these are some of the points that I want to highlight. Thank you.
Thank you very much, Asanga, for a detailed view on the prospects of regional cooperation on the aforementioned subject. I think the COVID situation not only, I think, did not break the health system in Sri Lanka, but it has exposed the weaknesses of the health system. So invert policies in South Asia and vaccine diplomacy, I think these are the things that we really need to tackle with collective efforts. So now we move towards the next panelist. The second, Nepal, and the second wave is entering into a deadly mode in Nepal, and it is said it can be worse than India. Health experts and frontline medical workers have described this situation as near apocalyptic, as they face shortage of hospital beds and oxygen. The national vaccination campaign grinds almost to a halt, and the number of deaths are so high that mass cremations are being held. So how the government is tackling with the situation, and what challenges they are currently facing with. To discuss the situation, we have Dr. Prakash Bhattarai with us. Dr. Prakash is having almost 20 years of professional academic experience on issues surrounding governance, peace building, development, migration, and more. And Dr. Bhattarai currently serves as the president of Center for Social Change and the research advisor for GMC Nepal. He has extensive experience in leading and coordinating various youth and student organizations, along with a strong consulting portfolio. Working as a researcher and M&E expert with a wide array of international development-centered organizations, he holds a PhD in Peace and Conflict Study from University of Otago and Master's Visiting Scholarship Relationship with Tribhuvan University, University of Notre Dame, and Uppsala University. Today, Dr. Bhattarai is one of the leading researchers in Nepali governance, politics, and peace building. With this introduction, I hand it over floor to Dr. Prakash to please apprise us the situation in Nepal. Over to you.
Thank you, Mr. Imran and IRS, for this wonderful opportunity to share this panel with other distinguished speakers, and also to highlight some of the most recent perspectives and a most recent situation that Nepal is facing as a result of COVID-19 crisis. You are truly pointed out that this second wave of COVID crisis has been a quite big blow to Nepal, and actually it has been quite disastrous, and it has broken down the entire health system that we had. And if you look at the number of cases, number of per day cases, it's been between like 8,000 to 10,000, and the death is between like 150, and that has gone up to like 255, 260, you know. It's been a quite big challenge, and over the past few weeks, like hundreds of people died due to the lack of oxygen cylinder and the lack of ventilators. So I should say that it's been kind of like, you know, a lot of people has been killed, you know, instead of you know, death as a result of pandemic. But you know, the people have been killed is because of the government incompetence, you know, to tackle this sort of, you know, crisis in an effective way. So basically, you know, my presentation, I've like, you know, concentrated around this, the Nepalese context, and this, what are some of the missed opportunities in terms of the regional cooperation, and what could be done. So like, these are the three things that I want to highlight. So when it comes to the current context, no matter whether it was the first wave, it was during the time of the first wave of COVID or the second wave. So there has been a lot of, you know, politicization of the virus. So, you know, the naming and shaming among the political leaders, and, you know, the present Prime Minister dissolved the parliament, you know, during the time of COVID, I mean, in the midst of COVID, you know, crisis, and there was a lot of like protest was happening from the opposition side with the, you know, with how to say that, with the government action, and also, you know, the virus control, you know, always became a political agenda rather than an urgent humanitarian issues that could be the common concerns of, you know, all political leaders. So that was kind of, you know, the politicization of virus was quite big. And the second one, you know, why we have been failed to respond this crisis is the centralization of virus response. Like, you know, every decisions were taken through CMCC, this crisis, you know, this COVID management coordination center that was established at the central level, and that was taken, and that, you know, mechanism was taken each and every decision related to the COVID response. And though we have this, you know, federal governance structure and this three tier of government, like, you know, local, provincial, and the federal government, but like local and the provincial governments help were only taken when the federal government was in real trouble to address this, you know, crisis. So I think the centralization of virus response was quite a big issue. The third one is, you know, the lack of, you know, emergency preparedness. Like even for the first wave and the second wave, I think the first virus case that was seen in Nepal was only in the February, you know, in the February. And whereas, like, you know, country like China and other countries were already, like, you know, facing that sort of crisis. Even India and, you know, other neighboring countries were facing that sort of problem. But like it was not taken that much seriously until like it actually entered into the country and, like, you know, spread, and there was a kind of the cases of the community transmission as well. So this emergency, you know, the lack of emergency preparedness, and the second wave, you know, that was seen, you know, right now, that has been, you know, observed right now, you know, was also, you know, like the overall, like the political leadership and the government did not pay a lot of attention, like, to be prepared for the second wave, despite like the frequent alert, you know, that's been given by World Health Organization and, you know, the public health experts locally as well as internationally. The fourth one is, like, you know, infrastructure and a resource constraint. So this remained a quite big issue. Like we didn't have like adequate number of ventilators and the oxygen cylinders, the ICU bed, you know. So just an example, like, you know, in Sudur Paschim province, is one of the province, you know, which is the most backward province in the country, which has a 3 million population, and within, you know, to cover that 3 million, you know, population, we have only like 30 ventilators, so I think that's a quite smaller number. And it was kind of similar situation in even in other part of the country. And because of this difficult like geographical terrain, like the mountains and the hills, and and the quite limited number of like doctors and nurses in government services, and their unwillingness like to travel to work in those geographically remote places, that also impacted this COVID response processes. And definitely the other resource constraint, the immediate medical facilities that Nepal used to get, that could not get on time. And the and the misinformation, like as Professor Swaran Singh and Asanga was also pointed out, that this misinformation has been a quite big issue. And even this misinformation like process was led by our current prime minister, who was like kind of suggesting some immunity boosting methods, which were not like not at all like scientific, but like he was kind of frequently repeating those information in public media, and try to mislead like a number of like people. And eventually, like when the death rates gone like really up, now he kind of realized that, okay, I think that was kind of his a wrong move. So the misinformation like that's been led by key leadership, some media, and and the social media gossip that has been a quite big issue in Nepal. And the another important concern, which is also quite linked with our geopolitical reality, is the management of vaccine procurement distribution. So whether we should be buying the Indian vaccine or the Chinese vaccine, or we should bring it from somewhere else, like what sort of like medical support that we need to be receiving from the US or the European countries, particularly like the Indian vaccine or Chinese vaccine. So the current government wanted to buy the Indian vaccine, and they had also like even paid like money for like 2 million dose vaccine for the Serum Institute in India. But the Serum could not provide like all the vaccines that was already paid by the Nepal government, whereas the present government is kind of is unwilling to bring the Chinese vaccine. So and it's been a quite big kind of debate that one country is very willing to provide the vaccine, but the government is not making its support, whereas other country, which in itself is in a big trouble, but government wants to wait and get that vaccine. So I think how to address this sort of geopolitical challenges, like in terms of receiving the vaccine and other medical supports, I think that's been one of the challenge for Nepal. And so what are some of the missed opportunities? Like based on my observation, I think in terms of the regional cooperation and the promoting like regionalism, I think there were some missed opportunities. There are some missed opportunities. The first one, I think there was a very limited or like no discussion around border control and management among Southeastern countries. So one of the reason why there has been a spread of virus in Nepal is because of our open border with India. And thousands of like Nepali people work in India as seasonal migrant worker. So when the crisis was begun in India, so there was no guarantee of their livelihood in India. So they rather wanted to come back to Nepal, in their place of origin, and that became one of the primary factors the spread of virus in Nepal. And the second one, in the second wave of this crisis, a lot of these Middle Eastern countries banned their flights to, to their country, from Delhi and from other Indian cities. So what happened is, taking advantage of this open border, as well as the flight, and no visa, without flight. So thousands of Indian citizens who came to Nepal and stayed here for a certain period of time without without adequate quarantine facilities. And the that also became another factors, the spread of virus, in Nepal. So I think we really missed opportunity to have a sincere dialogue among Southeastern countries on issues around, border control and border management, and and also discussing around the topic of the protection of cross-border migrant workers, how to protect them during the time of crisis. So I think that's been one of the factors why it's been, quite spread out across the region. And the second point, I think we also kind of missed to discuss on the topic of joint investment on vaccine research and its mass production, because now it's been a kind of the vaccine is needed for everybody, whereas it seems like one country or one particular company is taking control of it. I think if there would be discussions around Southeastern countries to develop some sort of mechanism for joint vaccine, research as well as production, I think that could be an important opportunity for all South Asian citizens to get vaccine on time. I think that's been the second missed opportunities from my observation. The third one is the lack of preparedness for responding to second and the future wave of COVID crisis. Like when there was a first wave of crisis, there was a lot of discussion around masks and sanitizers and the gloves and the production of these things, and also the vaccine debate was just begin. Whereas in the second, but there was not much debate around the oxygen cylinders, ventilators, kind of issues and agendas. Whereas in the second wave, these things became the primary need, and also these accessibility of vaccine also became quite big issue in the second wave of COVID crisis. And we don't know what would be the need in the third wave. I think we have not discussed yet. I think there are some news coming out that the third wave will severely impact children, or the younger people, the younger generation. I think what would be the need for the third wave of COVID crisis? I think we still are missing an opportunity to have discussion about our future needs to respond to this crisis. The fourth one is also we also kind of lack of assessing regarding lack of assessment regarding our regional capacity to respond to the crisis. I think we don't know which countries in South Asia has what capacity, and how can we help each other? How can we offer access and our help to each other? Who has the larger number of ventilators? Who has other ICU bed, or who could provide other medical products that could be used to cure the patient of COVID crisis. So I think the assessment and adequate assessment of the regional capacity to respond this crisis, and sharing that that analysis across the political actors, civil society, I think that's something very, very important, but that's also kind of missed opportunity. And also, we also kind of missed this sort of, frequent sharing of regional experiences and practices on virus response. There was, I can remember only one dialogue that took place last year among the, key government leadership that how to tackle this problem. Rather than that, I have not seen like any regional debates and discussions around crisis response, at least at the top leadership level. And as Asanga, as well as Professor Swaran, and even Ambassador Riyaz mentioned about this, the existence of SARC, but I think this SARC as an institution has been a coma. It's also been infected by virus, and it's not been able to be, it's not able to be very effective to convene that sort of forum, so that could, create an opportunity to discuss on regional issues, solve regional issues. I think that's also been kind of, a missed, opportunities. So what could be done? I think I have like four major recommendations. I think we definitely require an active convening forum to bring like different actors together. I totally agree that we need track 2 as well as track 2 diplomacy, as Asanga mentioned. But I think we need to work on this multi-track diplomacy approach. I think that's something very, very important, and what a South Asian nation is currently looking for. So I think we need to adopt this multi-track diplomacy approach, and in whenever possible way to find out the best solution. And I think we definitely need to do an exercise for the regional priority setting. So I think the regional priority setting is a kind of missing, and I think if we want to look for this a long-term program for addressing this healthcare crisis, I think we need to prioritize. We need to have a kind of the list of regional priority, and there needs to be like a common regional vision for addressing those priorities. And also though there is an existence of this South Asia level like the crisis response fund, but I think how to mobilize it effectively, what are the mechanisms, what this crisis response fund is currently doing. I think it's not been that much effective. So I think we need to activate this to respond to this crisis. And I think we all need to work together, or I think from academia, from media, from civil society, we need to kind of put pressure and kind of start a campaign that the vaccine for all South Asian. I think it's only Bhutan who has been quite successful in terms of its vaccination program. I think almost 60% of its citizens are vaccinated. I think we need to initiate this campaign, this vaccine for all South Asian. And for this, we need to put pressure to increase mass production capacity. And to do that, I think we need to do the joint investment from South Asian countries. I think that's something very, very important. And the last, but not the least, is we need to have some sort of resource sharing mechanisms among South Asian countries, and try to support each other. So I think if you could do that, I still believe on regionalism, and I still believe on collective approach, but I think we really need to kind of resume this dialogue kind of convening dialogue kind of forums, and that's something very, very important. So thank you very much.
Thank you very much, Dr. Prakash. As you said, the situation I think in Nepal is alarming because Nepal is facing both internal and as well as the external challenges. There is a centralization, politicization of the virus. It's also a big issue, and a lack of emergency preparedness is also a big issue that needs to be tackled. And vaccine diplomacy, of course, is a problem. So as you said, the missed opportunity in joint research on the vaccine. I think it's not a missed opportunity. We still has time. We can invest. The South Asian, the government should invest into the the joint research on vaccine through the IRIS platform. I think we must urge the governments in South Asia to have a joint research on the vaccine, and also share virus response experiences with each other. So with this, I thank you all the panelists for a wonderful presentation. Now we take questions from the audience. Is there you can ask the questions verbally, or you can paste the question in the chat panel. So the floor is open. I have a question already in the chat panel from the research analyst Shahid Ilyas of the Institute of Regional Studies. His question is to Professor Swaran Singh. He said, "Thank you for being in the panel. I am Shahid Ilyas from Institute of Regional Studies. My question is that hasn't the pandemic provided a window of opportunity to Pakistan and India to use it for normalization of bilateral relationship?" So I think this is a very pertinent question that needs to be addressed at this forum. So over to you, Professor Swaran Singh.
Thank you, Imran, and thank you also, Shahid Ilyas, for asking that question to me. Definitely, COVID-19 has come as a wake-up call to rethink on all aspects of life, including, as I mentioned in my initial remarks towards the closing, how we understand national security, what is significant for our national security, and how to organize that national security. So in that rethink, of course, there is great opportunity to also reconnect and reset bilateral relations. I also said that COVID-19 has come as a great infliction. But if you really want to look at the positive spin-offs, then of course it created an unusual situation where after 5 years of gap, we had the first SAARC summit again virtually now. And of course, we had a connection of health professionals where again, in these platforms, India and Pakistan come together. So yes, it's not that COVID-19 has not created opportunities both to reconnect and rethink. But I also, if you remember, underlined that when we are in stress, we are guided by habits rather than cognition. So I would say to a large extent, yes, our habits have also overcast our opportunities to think out of box and try and sort of reconnect and reset our relationship. So it's kind of a half glass full situation where, yes, the pandemic has given us some opportunities between all South Asian countries, but also, as you mentioned, India and Pakistan to come together and think afresh. But it also has showcased how we still continue to be mired in our habits rather than sort of cognition, and therefore have not fully perhaps utilized opportunities. And that is from both sides, so that we have not been able to fully reconnect and utilize that opportunity to redefine our relationship. I hope that is where the work of, as Prakash said, academics and sort of policy practitioners who are now in think tanks or academics like me comes alive to really push for that rethinking and reconnection and ability to rethink and go out of box and ensure that your cognition guides your future rather than your habits. Habits are guided by past and cognition by future, and therefore if focus has to be on future, we have to behave far more rationally and explore opportunities to reconnect and build synergies among South Asian countries together, but also because India and Pakistan are the two largest countries in the region, I think there is a need to also think afresh how two countries, India and Pakistan, can also come together and look at the holistic region called South Asia and give a certain positive spin to building cooperation in these two countries. Thank you, Dr. Ilyasi, for your question, and I appreciate that you had this comment called questions.
There is another question, Arishullah Khan. Please go ahead. Arishullah Khan is research analyst and the editor of the Institute of Regional Studies. Please.
Thank you, Imran. I don't have a question. I have a comment actually. As Asanga pointed out about the risk factors that have been brought up or exposed by the pandemic in South Asia, and whether we may call it lack of a functional democracy or prevalence of populist politics in South Asia. But I think instead of putting the whole blame on the politicians, I think we need to ponder over the greater problem, social problem in South Asia. And I think lack of critical thinking, lack of education, which I think prompts the politicians to go for populist methods. And as was also pointed out in the presentation of Prakash Bhattarai Saab, that the politicians then have to respond to populist perceptions, and the perceptions are shaped by the level of their education and the level of their understanding of certain scientific facts. So I think in the long term, I think all the South Asian countries would need to address this structural problem in the society. Thank you.
Thank you, Arish. I have another question in the chat. This question is from Nikesh Kumar. Sir, what should be the alternate strategy for lockdown and revival of economy as businesses are shut down, no jobs, and it's a breakdown of economy? So I think this is a dilemma that all the South Asian countries are facing. We do not have enough resources to feed our population. So it's a common problem. So what any panelist can comment on it? Professor Swaran, would you like to respond to that question?
I'm sure I'll be happy to say a few things, but maybe Ambassador Riyaz would also add on to. I think it's an interesting question. And my quick answer would be that we have to look at this in two ways. One, we have to look at how to sort of bring resilience to human activities that we have had so far, because that is how human evolution has happened, both in terms of production sector and also in terms of creativity. But we also at this stage need to think of how to perhaps redefine some of our activities, the way we have done those activities so far, and how we can innovate and do the same activity differently. For example, this online conversation that we are having is an innovation where we are able to still reconnect. We are doing the same activity of discussing and talking to each other, but we are using online platform to make that possible. And we realize that this, in fact, makes it far more potent in many ways, because one doesn't have to sort of sit in airports, sit in aircraft, apply for visas, go and check into hotels. It's a quick connect, and it's equally effective connect. It's also cost effective in that sense. So how technology's infusion can help some of our activities become not just efficient, but also cost effective is something we need to explore in terms of germinating and encouraging employment, connectivity among countries. So in that sense, it's an opportunity again for redefining how we manage our life, how we do our activities, including international relations. For example, we are noticing how online submit meetings have become so much more in the vogue. And we have to, then create skill sets for our younger generations that they should be able to, for example, future diplomats should be trained in IT skills, for example, increasingly, so that they can still connect online. Because if this is going to be the way, even if we go back to normal life, I think countries, people, academics, think tanks will continue to use these additional platforms that we have learned to use now. So some of the activities that we have been doing can be also redefined. But I look forward to Ambassador Riazi having something to add to what I just said.
Thank you very much. I couldn't agree with you more that, some of the strategies which we have used fighting the COVID pandemic, they are here to stay. And yes, I guess diplomacy has evolved. in a way that, previously we would be sitting in rooms and discussing these things, and now we are actually discussing them over the air. I think this is something which is there, but for effective handling of a pandemic like this, I guess there is also a need to change the mindset and the customs which are prevalent, especially in this part of the world. We are very warm people. Like, we like interacting, we like hugging, we like shaking of hands. So in the since last year, I think these are the things which are slightly going out of vogue. Well, out of vogue, maybe not the right term, but like, they are being reduced. But then we have large weddings, we have large funerals, we have big social gatherings, political rallies, congregations in mosques, in temples, I mean, in churches. So I guess on one hand, there would be a change in the thinking in future, but I think it will be slow. That's what I think. But basically, what the question really was that, is there what I have understood? Are there some alternatives to a lockdown? So I guess you can have a selective lockdown. You can, because, I mean, in countries of South Asia, where the education level is slightly much lower than what they have in Europe and all, we have economies in which they are labor intensive. So a person who goes out and does manual work, or like, who does gardening, or like, is a mason, uh, there can be no virtual. He or she will have to and put in the many hours to get the bread to feed the hungry mouths which are at home. So I gather while we will look for ways which are modern technological ones, but at the same time, I think we need to change the attitudes of the people towards the pandemic. What I mean by that is that more awareness, uh, better hygienic conditions, at least cleanliness. Um, I guess that would be something which would prepare the people to cope with the various strands, because it's not going away, it's going to be there. But at the same time, like when you talk about the larger economy, obviously, uh, the opening and closing of businesses will have to be, I think, somewhat streamlined, because at least in Pakistan, like, people open their shops at 11 in the morning and they go on till midnight. I mean, for God's sake, I mean, where else in the world, in Europe and all, they are strict regimented timings. And during that timings, like, effective business is done. But so I guess the change of attitudes, smart lockdowns, uh, effective working hours, better hygienic conditions. That could be the way of ensuring that productivity doesn't suffer, but at the same time, people don't get exposed unnecessarily to the pandemic. So that's the way I look at it.
Thank you. Yeah, Mr. Sangha, please go ahead if you want to add something.
Yeah. I would like to add something from our first wave, which we learned. One of our best practices was on contact tracing. The military had an excellent contact tracing strategy where, the first wave was crushed within a few weeks. It was brilliantly done with the assistance of the general public. The Nepal, what I heard was very similar to what's happening in Sri Lanka. the strategies which came after the second and the third wave was completely, not supporting this situation or to address these issues, such as the concocted tonic, which is discussed in Nepal. It happened in Sri Lanka also. So I think for the boosting of the immune system. So these are I think it's important that you bring in some rational thinking, as well as you address the lockdown wouldn't have happened if we manage it very well. Now that we have the lockdowns in Sri Lanka as well as many other countries, we shouldn't think that there isn't another way. So we are already thinking that this is the last way, but that's not the case. It's not the end of it. The pandemic, I think we need to prepare every day for this. And let's look at New Zealand. I spoke to someone from New Zealand a few days ago. Tremendous. What they have done from day one, I would say that they will look at a very rational way of looking at the pandemic. So now they could have even a live concert with 40,000 people without masks. Nobody's wearing masks in New Zealand, so you don't need to wear it. So this is the thing. So you manage it well. You don't think this is the last wave. And then I think that would be the best way to go.
Can I also add?
Thank you. Yes, please, Dr. Prakash, would you please add?
So basically, when it comes to the we know that the economy has been badly affected as a result of COVID, but I think it's a government responsibility to support the people who are at the bottom. I think there are millions of people who are not able to, especially people in informal economy, because that's also one of the issue that I'm working in Nepal and have done some research. So I think they really need to bring under the social safety net program of the government, and I think it's a government responsibility to protect them when they are in serious need. That's one thing. The second thing is every government must prioritize their developmental interventions. I mean, if you look at the South Asian countries and their security budget, that's quite high. Whereas people are dying, people are below the poverty line. So I think it's also time to rethink our annual budgeting, our annual programming and the budget allocation process, and try to find out ways where we can best support our people. I think if we accept this as a national security challenge or a human security challenge, then I think the budget allocation process of the government need to be improved significantly. I think that could be another strategy. And I totally agree with Ambassador Riyaz that the smart lockdown is something very crucial strategy. In the first wave of COVID crisis, the centralization, this COVID response mechanism, they just imposed a nationwide lockdown, whereas there were only 20 districts out of 77 were kind of badly affected by the COVID. Rest of the 57 districts were not at all, but schools were closed, and economic were closed, and everything were closed. I think every government need to develop a proper strategy with a sound assessment that where lockdown is necessary, where the economic activities must be stopped, where not. I think this smart lockdown should be adopted. I think that would be another way to save our economy either fully or partially. So thank you very much.
Thank you very much. Thank you, panelists, for answering these questions. I just want to ask a very simple question from Professor Swaran Singh. So in the beginning, India had enough vaccine As we were just reading the articles that India is about to export the vaccine to other countries as well. So what happened? What went wrong with India that it could not immunize its people on time? So partly you have mentioned in your presentation, but what specific thing happened with India? Would you please respond to this question?
Thank you, Imran, for asking me an additional question. I'm happy to answer that. If you look at, I'm a professor, so I go back for lessons in history. And I teach disarmament studies. And I look at how India has behaved in disarmament negotiations. India has always been driven by far more normative, optimistic, idealistic ways of conducting its foreign policy operations. So when it had absolutely good amount of expertise in nuclear technologies, India was pursuing vehemently nuclear disarmament treaties. So India ended up promoting partial test ban treaty, promoting nuclear non-proliferation treaty, which ended up working against India, because India then could not become a member with nuclear weapons. Likewise, compared to look at how other states are behaving, United States, which has virtually inoculated every adult of its population, is still, some people even use the harsher term, hoarding Covishield vaccines of AstraZeneca. It's keeping them as reserve in case it might need. India, on the other hand, when it found that the infections had come down from nearly 100,000 to 16,000 in January, declared that it was now sort of very comfortable and it could now start exporting these vaccines to all countries, including in the neighborhood. So we had this vaccine Maitri project. And India started, looking at that India is now in control and we can export these vaccines to, all countries, all over Africa. 25 African countries were receiving, all the neighbors were receiving. Among others, you remember the WHO's COVAX program decided that India potentially would supply 45 million doses to Pakistan through WHO, of course. So that was, I think, a very, very pious desire of India to, distribute vaccines to largest number of people, and that came from the civilizational understanding of the whole world being a family, Vasudhaiva Kutumbakam, which means India is connected to the whole world. And ideally speaking, as I mentioned, even if one single person far away is infected, nobody is secure because we think this will spread again. And then, of course, now there is a certain amount of concern in India that many experts were advising at that time that second wave would come, second wave could be far more dangerous than the first wave, and perhaps we found ourselves to be ill prepared to deal with the second wave, and therefore soon after we got into second wave, India started realizing that we need to inoculate, provide vaccine not only to 45 years old and older people, but also provide vaccines to entire population, entire adult population. So India, which was distributing vaccines around the world, had not only to now make sure we urgently provide vaccines to 45 years and older people, but now provide vaccines to every adult in India. And we are here talking about 135 crore 1.38 billion people. So when you suddenly decide you need to inoculate such a large population, and the challenge is formidable. And in that time of challenges, when United States also decided to ban on export of materials that Serum Institute of India was using. So there are multiple factors that came together that made India really sort of feel that it is vulnerable to providing vaccines to people at home, but also not in position now to continue exporting those vaccines to the rest of the world, to the immediate neighbors. But I believe those capacities of India have not disappeared. If any country in the world has capacity to produce maximum volumes of vaccines like this, it is India. There is no doubt about it. So there is a certain unusual situation of India being under, as I keep saying, stress of providing these vaccines. And as situation is now indicating that we are moving towards control of the second wave, I think India will begin to produce vaccines both for its own population, which there is no harm in saying remains the first priority. But soon after India feels that it is able to stabilize and provide vaccines for its own population, India is definitely going to open up and restart those exports to other countries, not simply guided by this benevolence, but also guided by a very hard cost-benefit analysis, because if other countries continue to be infected, then India is not safe. So it is an interest of India to also go out and help other nations. So I think we will see that in coming weeks, as India begins to feel more comfortable at home, those exports would again come into consideration. And we will really see India exporting those vaccines again. And it is simply because of the close connection that India and Nepal have had that, as Prakash just mentioned, Nepal is the best case country in South Asia for having inoculated about 7 people in every 100, compared to Afghanistan, which has only inoculated about 0.6 in every 100 people. So we have to really see that we all work together. And I think that sense is very clearly there in Indian policymakers, that we really have to take care that entire neighborhood is inoculated. But because of stress, as I mentioned, and in stress, all of us, including nations, behave driven by habits, and of course, your own citizens become first priority. But I believe that as the trends appear as of now, the second wave is really tapering away, and we are feeling that much more control on infections on everyday basis has happened already. My own city is seeing enormous improvement, and infections have really come down in New Delhi or in city of Delhi because of lockdowns. So I think there is a hope that we will go back to inoculating more and more Indian people, and of course open up India's exports of vaccines to all the neighboring countries and to the rest of the world as well. Thank you for giving me the opportunity to explain.
Thank you, Professor Swaran Singh. As you said, the Indian biased desire also factored in for not having a complete immunization of its people. I think this kind of a biased attitude is also hampering the regional cooperation as well. I think we have to end this session here. It's been 2 hours, and hopefully we will meet again. In the end, I would just say that nobody knows how long we have to fight with this pandemic and its after effects. Countries in South Asia are already lagging severely in almost all human development indicators. The high politics have always dominated the region and did not allow the constructive thoughts to flourish. But I think this is the right time to cooperate with each other, as people are dying in the hospitals, homes, and even in the streets. Through this platform, I urge all the South Asian government to come forward to lift the region out of this pandemic catastrophe, and also urge the governments to please to allocate a larger chunk of in the budget for improving the health infrastructure in their respective countries, and keep the surveillance operational even after the decline of the COVID cases and virus mutation, as a virus mutation is still is a big challenge. So with this, I once again all the panelists being a part of today's discussion. Thank you very much, Ambassador Nadeem Riyaz, Professor Dr. Swaran Singh, Mr. Asanga Abeyagoonasekera, and Dr. Prakash Bhattarai for sharing their thoughts. Thank you very much. We will invite you again on a burning topic again like this, and we have to cooperate each other. Thank you very much, and Allah Hafiz. Stay blessed.
Thank you very much.